Is being recorded.
Hi, this is Rich Brown. I would like to take this opportunity to thank all the citizens who are going to be viewing this video. It is being presented by Dr. Kevin Herrick, and hopefully it will have value to you and you'll be able to use it to have a better understanding of what this virus actually is. Dr. Herrick?
Thank you very much. We wanted to put together a brief video to catch you all up to speed on this COVID virus pandemic, as well as why exactly we're being quarantined. The specific learning objectives I wanted to put together were to bring us up to speed on exactly what is a virus. I don't think everyone fully understands what viruses are and how they're different than bacteria, for example. Then I wanted to go into a few details on facts that we know about this virus so far. And finally, what we can do to save lives, because in the end, we're actually in charge of saving lives with this virus. So first, let's talk about what is a virus. To do that, I need to bring us all up to speed on some basic concepts of biology. We're going to talk about what is a cell, animal and plant cells, bacteria, what those are, and viruses. We'll get into that. So here's a diagram of what a cell looks like. This is an artist's rendition here on the left. The pink cell here is an animal cell. The green one's a plant cell. There are slight differences, but there's a couple of basic points I want to mention. The first is that cells contain little machinery inside of them. They're bags basically of biologic machinery. And what the machinery does is the nucleus here contains DNA, which is nucleic acid. It's made up of 4 different bases. That's not too complicated, but the way that those bases are arranged are kind of like letters in a sentence, and they can make different meanings based on the arrangement of the letters. So the DNA in the nucleus is the basic information and contains the sequence of nucleotides, which are the genes that give rise to the functions of this cell. The cell is going to read that DNA, they interpret the sequence of that, and create proteins based on that sequence. The way it creates proteins is it puts together amino acids in a particular sequence based on the sequence information that was in the DNA. Once the cell has proteins formed in a particular sequence of amino acids making the protein, that protein will assume a function, and the function that it has will impart upon this cell the function of that cell. For example, bone cells, muscle cells, nerve cells, they all function differently in a person because they have different proteins that are expressed in those cells. Off to the right here is a photograph from a microscope showing cells as well as the nucleus. Here the pink is stained, the nucleus is stained pink. So that's just sort of what the cells look like under a microscope. Now these cells are very small. You'd have to look with a microscope at a high power to be able to see them. Most human cells live in association with each other, and that's what makes our bodies. But there are some cells in the world that kind of live independently, and that would be an example of a bacteria cell. So this bacteria here is a picture on the left. We have a bacterium. It's a diagram. This is a one-celled organism. It has inside of it machinery to read DNA, make protein. It can do all of that. And it lives by assuming or acquiring some nutrition generally from outside of it. So the bacteria lives on surfaces, lives in water, lives in any kind of a media that will provide it sugar and perhaps proteins, nucleic acids, and amino acids so that it can create life and create proteins that it wants to make in order to survive. Now, bacteria are single-celled organisms, and what they will do is to grow, they simply copy themselves and divide. So one parent bacteria will become 2, and then those 2 will each divide and become a total of 4, and then the 4 will each divide and become a total of 8. And they grow simply by cloning themselves and spreading. Down here on this Petri dish, you can see here's a scientific experiment, it looks like, where they had a Petri dish, they put some agar gelatin on it, and then they put a single bacterium in each of these spots. And you could not see those bacteria 3 days ago. And they let it sit and grow, and those bacteria that were on each of these spots grew and duplicated and multiplied until they became a colony of identical bacteria. So here on this dot, we have one colony of a bacteria, all the descendants of one bacteria. Here is another colony, all the descendants of the bacterium that was on this spot of the plate, and so on. Each of these 30 or so colonies originated from one bacteria. Well, why is this important? Well, here's a patient who has a small abscess behind their ear, and what happened is they got a pimple, and the bacteria, a bacterium, got in there, and their defense wasn't good enough. The patient's defense wasn't good enough to fight this infection off and kill it immediately. So the bacteria, finding itself in a new environment, was able to create some growth, and it duplicated itself until you had a big ball of bacteria and pus. And that's what happens with bacterial infections. Now, this picture here on the left, the one with the purple bacteria, I chose it because I wanted to show the relative size of a bacteria, which is right here, this big blue thing, compared with a virus. These little red guys are viruses. We're going to talk about those next. So a virus is unique because it does not have any form of machinery inside of it. All it's made up of is a little space capsule of lipid here with some DNA inside. It has DNA for its genes so that those genes, when they're interpreted by a cell's machinery, can be made into protein. And it also contains on its surface these proteins, and what those will do is allow this virus to assume a particular tropism. It'll allow the virus to attack certain types of cells. So not all viruses can attack all cell types, but when you have a virus that's able to, say, attack the nose cells of a bat, and it doesn't typically infect humans, it's because the surface proteins on that virus are shaped in such a way that they will mate with the proteins that are on the surface of the bat's nose cell. And during evolution and through nature, when you have a change in these proteins, when a mutation happens and a new shape is acquired by a virus, now it's able to jump from one species to another. So there are literally thousands of viruses that are infecting people all the time, and most don't cause any trouble. The typical progress is you'll have a person, a host, we call it, who's susceptible, meaning they're vulnerable to an infection. The pathogen, which is a bacteria or a virus, can become exposed to them. The pathogen will grow in the cells or in the body of that host. The host will develop some symptoms at some point in response to that growth of the pathogen, and they're going to try to control the infection. Usually what happens is any cell that gets infected by a virus is probably going to die. That cell will die, but the host, the animal, can respond by having other reagents happen, other cells that attack those cells that are infected. They can also raise their temperature, sometimes a fever. But ultimately, they will sequester, isolate, and eliminate the virus. And for complete resolution, we usually use antibodies, which are very important to help us maintain immunity against that type of virus, that type of bacteria with those presenting proteins on them. There's a certain, every now and then in human history, we have pandemics, and that comes from a bacteria or a virus, and they have these kind of properties. Generally, a pandemic bacteria or virus is deadly enough to matter, but perhaps not so deadly that we pay attention to it. Kind of like this COVID thing. In the beginning, we all heard about it, but it was killing people on the other side of the planet and not very many. It's also easily contagious. That way it can spread from person to person. It can be spread before the infection is present, so people who are without symptoms can spread it. That's an ideal germ to become a pandemic. A pandemic happens when the hosts have never seen this kind of bacteria or germ before, this kind of virus, and that will make them susceptible because they don't have immunity or antibodies against similar shaped proteins and similar shaped viruses. And finally, it won't be a pandemic unless we lack treatment. Otherwise, we would be able to wipe it out. So this COVID thing is a perfect example of a pandemic type of germ. It has all of those characteristics. Now, in a population, whenever there's an infection, you can stop it through these four ways. You can either have medications to treat the infection, or you can have people develop their own immunity, either by vaccinating them or developing their immunity because they have been infected and now they are immune. So if you get enough people who are immune to it, then what we have is something we call herd immunity. And the virus can't really spread through a herd of people when most of the people are immune to it. It doesn't have enough hosts that it can jump to, because whenever a virus invades a host, that host is going to end up either dying or defeating the virus. And so the virus's days are numbered. It doesn't live in a dead host, and it won't live in a defeated state. So it can only live by jumping to another host, another person. That's how this virus can continue propagating itself. And when you have herd immunity and most of the population is immune, then they can't jump to other people who are susceptible. And the final way to stop any infection is by quarantine. If you isolate every individual, or if you isolate every family unit away from each other, then the virus can't jump from one quarantine unit to another because there's been no contact. So those are the tools that people have to defeat any kind of an infection in the population. We need medications, we need immunity, or we need a quarantine. Let's start talking a little bit more interesting about this COVID, what we know about it now. So there's already been some studies done on the poor folks that were on the Diamond Princess. We had studies that were done on the folks in China, and some of these research papers have already been published, and this is what we know so far. This virus infects people, and we call that time zero. If you get exposed to the virus and it makes it into your nose or your lungs, that's day zero. And what we know is that 5 days later, half of the people who have been exposed to that virus will be having, those who will develop symptoms, half of them will show those symptoms by 5 days. That's how I want to word that. With this virus, there's a lot of people who get the virus and they never develop symptoms. The virus is growing in them, but their body is so strong that they don't even get a runny nose. They defeat the virus over time, but they never had symptoms. That's happening a lot. We're finding that somewhere between 10 and 50% of people who acquire this virus actually have no symptoms, ever. The other portion of people who get the virus do develop symptoms, and those folks, they're going to show it basically about 5 days, but some of them show it after 3 days, and some of them have symptoms after 10 to 12, some of them out here at 15 days. What are the symptoms of COVID? This came off the CDC's government's webpage today. Those who develop symptoms usually will have a fever, 83 to 90% of the time, 99% of the time. Many will have a cough. About 60 to 80% of the folks with symptoms are going to have a cough. Some will have fatigue, anorexia. They're not hungry. Over half the people lose an appetite. Fewer than that, 1/3 of the people have shortness of breath. Some will have a little bit of phlegm, and 10% to 1/3 of the people will have body aches. Sometimes the myalgias just come from the fever. So those are the common symptoms. There's also some reports of symptoms, especially in kids, of having nausea, vomiting, diarrhea. I wanted to spend a minute on the timing of the infection and then what happens to your body afterwards. Like I was talking earlier, a person might become infected at day 0 with this virus, the virus that causes COVID-19. Here's across this horizontal axis, you have time. So here's 0 days, here's up to 5 days, 10 days, out here 30 days. This is a month out. So what happens to your body? About 2 days into the infection, your body has begun to produce new viruses. That virus took advantage of the host. It infected a cell in the host at day 1. By day 2 or 3, that virus has used the host cell's machinery to build more viruses and destroy that cell, the human cell, and it is now spreading to other cells nearby. As that process is going, it's infecting nearby cells. Those get infected. Those create more virus. They burst open. They deliver more cells to more virus to the nearby cells. And so the viral infection inside the host is growing. And by day 2, the amount of virus that is present in that person is skyrocketing. It goes up here till about day 5. After that, the viral amount of virus in the body gets reduced because your body is starting to fight back. You have a fever maybe. Maybe your body is making interferon to shut down the cells nearby so they don't become infected. Your body has a lot of methods to defend itself against viruses. And over time, over the next week, the amount of virus basically depletes to essentially nothing. There are some stories that people can go on shedding virus for several weeks, but in general, you're going to have a significant decrease in the number of virus that are present in the host by about 2 weeks. At the same time, about day 10, the immune system, your IgM, is turning on, and it's a system that allows you to identify and attack at a molecular level any proteins that are present on the surface of those viruses. Our body is learning what those virus proteins look like. We're feeling it, we detect it, and now we're making little soldiers that go out and defeat and destroy anything with that protein shape. So the IgM comes on first, IgG comes on second. Those are 2 different soldier types. Call them the Navy SEALs, followed by the Green Beret. And what they do is they will attack and destroy viruses by dissolving them. First comes on the IgM about day 10, and then your IgG comes on a couple weeks after infection at day 14 or so. And that lasts quite a while. The IgM lasts for over a month. We're not exactly sure how long. Typically in viruses, that IgM is going to last for a few months. And the IgG typically lasts for life to confer a memory of what this infection looked like, so that next time we get infected by the same virus, our IgGs will be ready to go from day 1 and defeat it before you ever get this viral presence. Take home point here. Number 1, many cases of this virus do not have any symptoms. Number 2, people who get infected at day 0 begin to have viral presence in their body first, and then they have immunoglobulins that come later to help them defeat the virus. And number 3, I wanted to put 2 together to kind of a comparison. This first graph is how long from day 0 until people who do get symptoms start to feel symptoms. And usually it's about day 5. It can, like I said, go from day 3 to day 14, but day 5. But what's happening here at the molecular level in those same people? From day 0, they got infected, but look, they already had virus long before they had they had virus long before they had symptoms. And then finally, when the virus titer goes down, the amount of virus goes down, then you have your immune system being present to help defend yourself. I wanted to talk really briefly about what you're reading in the news about these confirmed case numbers. I pay very little attention to how many confirmed cases we have because we're only testing people who are sick, the sickest of the sick in the ICU. And how many people, how many hundreds of people are there walking around with this virus with no infection symptoms and maybe with mild symptoms? We're not testing them. We're not able to test them because we don't have enough tests. We don't have enough personal protective gear to do that. And everyone's being quarantined anyway. The reason for testing people is to put them in quarantine, and we're already quarantined. So the number of cases are going to go skyrocketing, but it's more a basis of how much testing we're doing than it is of actually how many cases are out in the community. What I do pay attention to are the number of deaths, because the number of deaths are a measure that are real. They present themselves to us. People show up in the emergency room, they show up in the ICU, and if they die from this virus, we are counting them, we are checking them. So the number of deaths is a very real number that we can probably rely on, but the number of deaths we had as of today is a reflection of who got infected 2 weeks ago. These people don't just get the virus and die that same day. A person who is going to die from this virus actually gets infected and 2 weeks later dies. So our death rate is lagging behind, if you will, the number of infections by about 2 weeks. I want you to take home and remember something. Even though we're talking about death, most people, the vast majority, will recover within 7 to 14 days. And one of these measures they keep saying is the total cases since January 21st. That's a lot of folks, and the numbers keep going higher, but it doesn't take into account the number of people who have actually recovered. The number of cases in Santa Clara County are about 1,000 and something right now. But 800 of those have actually recovered. So those people are not infectious. They can't pass it on to you. They're not going to get it again. They're out of the pandemic. They're done. They're one of the herd immunity that we want to have. And so you'll see numbers going higher and higher and higher, but we really need to remember also that the cure rate is going higher and higher and higher also. And they don't seem to be reporting that as much. Okay, so here's a couple random COVID facts, and then we'll get to some good questions, what you can do. Many people never seem to be getting symptoms. When they do occur, it's about 2 days to 14 days after the infection. It seems to be spread by droplets and then probably by contact, because the little droplets of spit can land on things, can land on your hands, you can rub your nose, and you have microscopic amounts of spit and snot on your hands that you can pass on to other people if you touch them. It's probably passed in the stool too. If it gets into your in the stool, they've detected the virus in poop, and when we wipe our bottoms and don't wash our hands and go touch doorknobs, then suddenly it's on that. Technically, this virus is not what they call airborne, because airborne viruses can live without a water support around them. But this little guy needs to have a little bit of moisture around him, little water droplets, to keep those proteins on the surface of the virus nice and happy and not denatured. Yeah. And finally, the masks that people are talking about is more to prevent the spread away from a person, not in defense. So it prevents an offense, not a defense. The masks that we wear in public, that we're being suggested to wear in public, are because there's a lot of people walking around, and as more and more infections happen, more and more of the population is infected, there are people walking around without symptoms, and we want them to cover their mouth because they don't have symptoms, but they do have virus. So I treat everyone in public, I treat them as infected people. And if they don't have a mask on, I'm standing 5, 10, 15 feet away from them. Here's the dashboard. Doesn't it look busy? Oh my goodness. Let me point out a couple of things that are tricky on this, because it doesn't really say what you think it says. The first thing, here's the total cases, like I was talking about, ever since January, I think 21st is when they started keeping records on this. So Santa Clara County, as of today, April 6th, as of yesterday, we had 1,224 cases registered that had been tested. Here's a graph of that. It shows, oh my gosh, look at this going crazy. Well, this line right here on this last day, this line here is the total number of cases we've had at 1,200. See, right here's 1,000, so over here's 12. 1,200. These cases here are included in this line. It's just that as of this date, we only had that many. As of this date, we now have this many total cases. And a lot of these cases are cured. These people have gotten better. The vast majority have gotten better or are going to be getting better. The virus only lasts in you for about 5 to 10 days, and then you get better. The new cases, that's an interesting number too, but it totally depends on how many people we're willing to test. This new cases means there were 17 people admitted to the hospital with flu-like symptoms and they got tested and they were tested positive for COVID. This does not mean that there are 17 new cases in the county. There's probably 1,700 new cases in the county. Only 17 of them walked into the emergency room. Or maybe even 100 walked into the emergency room, and only 17 of them needed oxygen to be put in the hospital and got tested. This is a vastly skewed number. It is not accurate. These new cases are cases who are tested, and not very many are being tested. Total deaths. I do watch this number. We had 3 new deaths today. Yesterday we had 0. The day before that was 0. The day before that we had 1. So I'm going to watch this number tomorrow. This is who's died now after having struggled with this virus for several days. These people here, the 3 deaths, they were identified back here, several days or weeks ago as having COVID, and now they've struggled in the ICU and they actually expired. 3 people did today. That's probably an accurate number. Here's San Benito County's Public Health Service webpage. They break down cases by group, by age. And here, number of tests. Well, this is showing how many people are being tested, how many of those tests in purple are negative, and how many tests in green are positive. But again, this is totally based on how many people are having their noses swabbed and been tested. I personally know on my panel of patients, 15 people who probably have COVID. They have the fever, they have the chills, they're doing well at home. I am not testing them because the test takes over a week to get an answer back, and it doesn't change the care that I'm going to give them. They're going to stay home, take Motrin, Tylenol, and fluids. They're going to be isolated. It's the same care I would give them if they did or didn't have COVID. This is a really cool graphic that Lauren put together, and I really appreciate this. This brings home what is exponential spread. When you have one person, this is one person who's infected. And how long did it take for that person to spread it to another person? They just have to sneeze. They sneezed and 2 people were exposed. These 2 people, sure, they developed the virus. They had to elaborate it. A couple days later, they started shedding it. And 2 days later, they're now coughing on each of them, 2 to 3 people. 2 or 3 days later, how many do we have here? 5. These 5 people have coughed, and look how it doubles. In the matter of 1 week, you've gone from 1 person to 15 to 25. Now, we can handle in the hospital oxygen for everyone who needs it, but we can't do it this week. We can handle oxygen for everyone. All the few people who are going to do poorly with this virus, there are going to be some. We can help. We can do what we can. We can give them ventilators, but we can't do it if they all show up at the door today. So we can't handle all of these people knocking on the ER door today. We can handle these guys. So we need to slow spread so that we stay at a low level until enough people get immunized, either by infection or vaccine, or until enough medications get developed so that we can cure this and treat it so that people don't need to be in the hospital. That's what we're trying to do with this outbreak. Now, work with me on a second. Let's assume we don't have a good idea of how many people get infected. We don't have a clue how many people are infected, but we do know that there's a certain percentage of them who end up in the ICU and need a ventilator. And there's another percentage of them who just need oxygen and then they get better. They don't need a ventilator, but they do need oxygen. Let's assume for a second, just for the sake of discussion, that that percentage is somewhere around 1% who need a ventilator and 5% who need oxygen. Out of all the infections, and half of them have no symptoms, but 5% need oxygen, 1% needs a ventilator, respiratory support. If everyone shows up at the hospital the same day and we don't have enough oxygen for that 5%, that 5% is going to die too. So the death rate doesn't stay at 1% when we get overwhelmed, it climbs. It goes to 6%. Because not only the 1% who needed a ventilator, but now the oxygen needers, they don't get it. All of those people won't make it because we don't have oxygen available. That's why they're setting up surge tent. That's why they're setting up field hospitals, so that we will have enough oxygen and ventilators, hopefully, to match the demand, if we can keep the demand low enough and if we can build our resources high enough. This virus is spread by aerosolized. Again, Lauren put this together. I love it. Here's large droplets out of this poor, unfortunate vector. And she is trying to infect her friend over here, probably at some kind of a meeting. Maybe they went to Boy Scouts, or they went to a community center. Let's go have a wedding. Let's go play football in the community park. All right, so here's how fast it can go. This person's infected, this one is not, but this poor lady, she has large droplets. They can go 3 feet. Small infectious droplets of this virus in her, they can go 5 feet. Small, tiny droplets can go even further than that. There's no idea whether these are infectious, but we know that these are. So how far can it go? If someone coughs at you, you better be 20 feet away. If they sneeze in your direction, give it up, man. You gotta be 10, what is that? 10 yards away. What can we do if COVID's in our community? So this is the take-home message where you can get the most help. Let me get my notes back up here. See what happened. There you are. So the first thing I want to say is, unless your job is required for the functioning of society, such as food distribution, repairing mechanical leaks, providing essential transportation, police, fire, physicians. If you're an essential structural unit for our society, then you go to work. But otherwise, you should be staying at home in your house and not near anyone else. Your unit is your home. And if there's 3 people in that home, if there's 10 people in that home, if there's 1 person in that home, you are a quarantine unit. If 1 person in that home gets infected, it'll probably be going through that unit, but it's going to stop there. It's not going to go throughout society. It's going to be stopped at the quarantine unit of your home. Unless you have broken the quarantine and allowed that virus back in your house by exiting home, going to the grocery store, going to a party, going to a baseball or a football game, any of that, you're going to get exposed. Someone's going to get exposed, bring it back home, and within 2 days, that person will be elaborating virus and sharing it with all their family. So home, for God's sake, stay home until this is passed. You only leave home to get the most essential. It's really a life or death question here. When you go out, you are taking someone's life in your hands. It might not be your life, because you might do just fine with this virus. But what happens when you get infected, bring it home, maybe don't even have symptoms, spread it to grandma, and she dies? There's blood on your hands. You didn't have to go out of that house and get infected. You could have stayed home. So only leave if it's a matter of life and death. That means you've run out of food. You absolutely have to go get food, and then you're going to the grocery store you're maintaining distance, you're putting on a mask, you're putting on gloves, you wash your hands when you take those gloves off, the whole 9 yards. Yeah. When I'm in public, I assume that everyone, honey, I'm on the video. When I'm in public, I'm assuming that everyone around me is shedding virus. So I am wearing a mask if I can't maintain distance. And I don't have any contact with anyone within 6 feet of them. When I'm in the public, I also use a dilute bleach towel. I soak it in 1 cup of bleach, or I think a half cup of bleach in a gallon of water. And that solution I will dampen a towel with. I'll put it in a Ziploc bag. I walk around town doing my errand with that. If I'm going to go out and go to the grocery store, I'm taking that with me, and I'm not touching any doorknobs. I'm using that rag to make contact with anything that's publicly touched. You know, washing your hands with soap and water will destroy those viruses. Those proteins on the surface of the virus, we talked about it. Those little proteins are so delicate that if they dry out, they're dead. If they get soap around them, they're dead. If they get alcohol around them, they're destroyed. And when they get destroyed, they can't latch onto a human cell and inject their DNA or RNA, in this case it's an RNA, getting injected into the cell, and they can't hijack our cells and make more viruses. With those, it cripples the virus if you just wash your hands or wipe things down with dilute bleach. Number next, I take my temperature every day. I'm betting on the fact that 80% of people do have a fever. That fever might be low grade, it might be intermittent. But if I have a fever and I'm a physician, I am not going to work. I am not going to expose people. I am going to stay home, and then I'm going to make arrangements to see whether I need to be tested or not by talking to my doctor. If I feel ill, if I have a temperature over 100 degrees, I am staying home, even if I'm an essential worker. I think we should prepare to be tested for the antibodies. Remember, the antibodies came up afterwards, and that kind of showed that you were over the infection. You know, if you have IgG antibodies, I don't see any reason why you can't go back to work. You have defeated this virus, you have survived the infection, and you have IgG antibodies to protect you from being reinfected. So most all viruses behave this way. I would be very surprised if this COVID research will bear it out, but when we have IgG, generally we are immune. And so I think we should get that test done that checks our finger poke of blood, and we can identify whether we've already had the illness. Maybe we had a mild case, but we're now over it. That should be coming available in the next weeks at your doctor's office. Next thing I want to say is make sure you only access reliable information. I only go to cdc.gov. I go to our community web pages, these public web pages. I stay away from the YouTube stuff. This kind of stuff we're putting together, be real careful where it comes from. You can get a total quack talking about this stuff and they don't know what they're saying. It's really hard to get good, reliable information, and they will pass all sorts of theories. Try to stick to sources that are reliable and have used research-based proven methods. Finally, a couple ideas. Try to avoid being depressed. Stay active. Sew face masks for the hospital, for your neighbors. Deliver groceries to your neighbors. If you are feeling well and you have a neighbor who can't get out, maybe they're a senior and have risks, they don't want to get infected, then you do that run for them. When you're going to get your groceries once a week, ask them if you can get some for them. And pick up those groceries and deliver it outside their door and let them know that they're loved, that they're cared for. Be a community. Check on your neighbors. Make sure. A lot of seniors right now are particularly fearful. They see these numbers. They know if they get it, they're going to be dead. So these folks are hermiting in their houses, and they're frightened to death. So reach out to them. Let them know that they have neighbors that care about them. And remember that all this will definitely pass. The final comments I wanted to say is, if you break quarantine, if you allow anyone in your family unit to leave home and mingle with other people, I consider that a crime. I consider that assault with a deadly weapon, because whoever that is, they can be playing with friends, they can go to an important social event, but they get exposed to somebody, one person, who doesn't have symptoms but is shedding virus. They bring it home to your house. And now what? Now your house is infected. And maybe no one in your home will die, but your house is going to infect someone else if you keep up that practice. And down the road from you, you carried an infection to someone that died. There's no need for that. Just obey the quarantine. Stay home, save a life. I love what someone wrote. They wrote this: first time in human history that you can save the world by staying home, watching TV, and doing nothing. Don't mess it up. Check out the cdc.gov, who.int, and your local county health center's webpage, and they'll have a lot of information for you too. This is Dr. Herrick, and I think there are some questions maybe.
Doc, why can't we just take medicine to cure this?
That's a good question. I would like to be able to take medication to cure it. The issue about medications is whenever I give an antibiotic to a person, I'm trying to use a smart targeted molecule, a bomb. I want to destroy the invading infection like the bacteria or the virus, but I can't do harm to the human, right? I can't do harm to my patient. So I need to give them an agent, a medication that exploits some susceptibility of the infective agent like the bacteria or the virus. The trouble with the viruses is all they are is nucleic acid, DNA or RNA, surrounded by a lipid with some proteins on the surface. I mean, there's nothing there that I can really gum up on their copying mechanism, because what they do is they take their DNA or RNA, if they have an RNA virus, they take that material and they inject it into the cell of the human cell, and the human cell's mechanism for making protein is used to spurt out a bunch of viruses. So I can't block the mechanism for making proteins because that's our mechanism for making our proteins. I've got to block a mechanism that the virus uses. Some use a reverse transcriptase, and we took advantage of that with HIV. There's some antibiotics against viruses that are good for HIV, but there are not yet a lot of options to destroy viruses with an antiviral agent. They're looking into this hydroxychloroquine, and it is, I think Plaquenil is it called, and it is probably affecting somehow the ability of the red blood cells to become infected. And I don't want to speak a lot about that because I think it's still in the works of how its mechanism is working, but it's showing a little bit of promise for those severe cases in the ICU. And it might be helpful to them to have this old malaria drug that we used before. But we don't have antibiotics right now that can defeat this virus. So that is not available to us.
Thank you, doctor. What's the difference between a germ and a virus?
Okay, so that's a really good question. A germ, a germ to me means anything that's small that can cause an infection in me. It could be a parasite, it could be a virus, it could be a bacteria. And those are technical differences. Parasites are eukaryotic cells, bacteria are prokaryotic cells, and viruses are not even cells, they just are bags of DNA that infect us. But I would call all of those germs. It's sort of a colloquial term. And a virus is a particular type of infectious germ that, like I mentioned in the beginning of the presentation, has nucleic acid surrounded by a little spaceship of lipid capsule and protein that allows it to attach, almost dock. It'll allow it to dock like a spaceship to mothership. And what it does is that virus will use its proteins to dock to the proteins on the surface of human cells, and then it injects its DNA in, or RNA in this case, and it will use the cell's mechanism to make more of itself. It hijacks the mechanisms of the cell, the machinery of the cell, to make protein and copies of its own RNA and spit that out. So that's what a virus is.
Doctor, what about the maximum number of days before some of these patients are showing symptoms?
So we have evidence that we don't know exactly what percentage because we don't have a magic ball to see exactly who's been infected. In Korea, they tested almost everyone and symptomatic, no symptoms, and they found that the death rate was actually a lot less than 1%.
Wow.
I think the percentage that we're getting of 1 to 2% is because 1 or 2% of the number of people who are being tested who are positive. But if you have all these people down here who are tested, not tested, but are also positive, then that number of deaths is actually smaller.
Right.
I don't want to minimize this because the death rate will go up if we're not careful. Like I said, if we don't have enough resources, then that 1% might become 5%. But I think the total number of infections is much larger than what we're testing. So your question of the people who don't have symptoms, I think you can be infected and not have symptoms and get over this virus and never have had symptoms. You can be an asymptomatic case. Then there's other people who just haven't yet developed symptoms. So you're saying, well, I have patients who come to me and say, I was exposed 5 days ago, please test me. And I'm saying, well, I'm going to wait for you to have symptoms because I want to see if you're even necessary to test. So there are people who never develop symptoms, but if you develop symptoms, it's generally going to be at about day 5, generally not longer than 2 weeks from the exposure.
So the antibody test, that's something that will hopefully really assist in defeating this virus?
So the antibody test I'm referring to is a different test than what we are seeing on the news where everybody's gowned up. And when I take a PCR test, a polymerase chain molecular detection test, I'm putting a swab in someone's nose. What happens when you tickle your nose?
You
You
sneeze.
sneeze or you cough, right? So I need to be totally shielded because half the people I do this to end up sneezing at me. And those sneezes go 10 yards. I mean, that's a long way. I can't get out of the way. So I have to have full body armor. But what it detects is the presence of virus. And right now, the way to prove someone is COVID positive is with that test. That's what the government is asking for us to use. Now, stepping back from that, just from a molecular biologist perspective and a physician's perspective, I mean, we know how diseases work. People have virus, the virus goes away, and they have antibodies. So I can test for antibodies, and it's not going to tell me that you have the disease right now. I probably don't even need to know that. Right now, it's not so critical in our state to know if you have the virus because the treatment's the same. You stay home. Everyone's staying home. If you feel sick, stay away from each other in home. Well, that's happening too. If you get really sick and you can't breathe, go to the ER. Well, that can happen. So I don't really need to know if you have COVID. I can assume that you do. But that immunoglobulin test is going to tell me that you did have it. And you're one of the lucky few who had it, didn't know it, or you're one of the few, the many who had it and got over it. But I'm thinking this is going to be great for getting people back to work. When does this quarantine end? This quarantine ends when we're able to release people back to work to socially go back to associating with each other, and it's not going to re-erupt in our face. And you saw with one person how quickly it can spread to 60. So we can't have one person infected going back into the community and associating with people around them. That's too soon to undo the quarantine. This quarantine has to stay in effect until, one, we develop a medication that we can treat, or two, we get a vaccine, or three, we can detect herd immunity. We can know that enough people have had it and went through it. So those people who get tested, they can rest assured that they've already had the illness. They can go back to work. They actually technically wouldn't have to quarantine except to comply with the law. But there'd be no medical reason for them to have to quarantine because they're actually recovered. So I see this IgG test, IgM test that's coming out as being crucial in helping us in the quarantine. Yeah.
And when do you anticipate that test being available on a large scale?
My clinic ordered it 5 days ago. We were told it would be here by the end of this week. Today I found out that the distributor has it on our shores. It's made in Korea, but it's on our shores in a warehouse. They're not shipping it yet because they're waiting for the FDA to give approval, not approving the test as a verified test, but another piece of red tape was it's an okay test to run if you want to, but you can't run it in small clinics because we need to clear it to be a simple test, not a complicated test to run. This test is so simple. You poke your blood, you put it on a piece of paper, and you wait 15 minutes to see if a line shows. It's like taking a pregnancy test with a finger poke. But that has to go through government agency, and I got so irritated by that that my CEO, I had him call Zoe Lufgren today. Hopefully he made contact with her and in the Congress, and she can maybe talk to the FDA to figure this out because we need these tests, and we can have them as soon as this Friday, later this week, if they would just ship it. So the tests are here, but government's blocking it right now, in accidentally, I think.
Doctor, I got no other questions. Does anyone else have a question? That is a no. And doctor, thank you so much for spending your time.
Let me just add. I think I got a question earlier about how long the quarantine is likely to last. I think if we take what happened in China, they have a society where they knuckled down on that quarantine once they realized they had a problem in Wuhan. And the quarantine recently was lifted, and that was January till the end of March. That was a 2-month plus quarantine. And that was in a society that's pretty rigorous about, you break quarantine, you're going to jail. Here in our community, we've got people breaking quarantine. I hear there's football games going on, kids playing football. I hear people are going to dances. I think there's a couple weddings going on.
Oh my.
That needs to stop. If that doesn't stop, it ruins the quarantine for all the rest of us. It just drags this out longer. If everyone could honor the quarantine for 2 weeks, then you would have a situation where only families remained infected, and those families could stay home and work through it, and everyone else could go back to work because no one else would be infected. But because people are breaking quarantine, it's dragging out for the rest of us. My fiance is shut down her business to honor the quarantine, and she's been without income for close to 3 weeks now. And to hear that people are breaking quarantine and ignoring it for own selfish reasons or because of ignorance is making her sacrifice futile. So we need people to really honor this quarantine, not go out unless they're absolutely requiring food, and just honor it and wait it out. It's probably going to take a total of over 2 months, probably 3. And at that point, we'll probably have a test available to say, well, people who test positive for the IgG can go back to work and still be monitoring distance and social distancing, but you can at least return. I think something like that would be what I expect. Now that's speculation, but that's what I would do.
That sounds promising.
Any other questions? All right, well, stay calm and honor the quarantine.